this is something we struggle with in terms of adherence with continuous positive airway pressure for the treatment of obstructive sleep apnea. General adherence is thought to be around 50 to 70%. Our estimates here at the Cleveland Clinic are a bit higher, 80%, maybe even 90%. The struggle is really to try to identify the root cause of the problem in terms of why the patient is not able to tolerate the device. Sometimes it's pressure intolerance, sometimes it's a mask interface issue, sometimes it's nasal congestion, and we've pretty much seen everything, and we have ways that we can address those issues in terms of trying different masks, using heated humidification to treat the nasal congestion or nasal saline to treat the nasal congestion. If there's a pressure intolerance issue, then sometimes there are different modes of positive airway pressure that can be used to make it more comfortable. We also here at the Cleveland Clinic have some unique resources that we offer to help people with adherence, such as the CPAP clinic, which is a group-based clinic where patients can come in and get a better sense of what their issues are and how to address them, and relies kind of on a group dynamic for people to lean on one another and discuss the issues they're having, which can be really helpful. The other resource that we have is the PAP-NAP study. This is a daytime study where patients with sleep apnea who are struggling with adherence have a one-on-one session with a sleep technologist who really tries to help desensitize and acclimate the patient to positive airway pressure. And there are some published data to show that that is an effective strategy in improving adherence. And people talk about the poor adherence with positive airway pressure, but when we really think about things, it's around the adherence of medications as well. So 50 to 70% is probably a reflection of what real-world adherence is to oral medications.